And I can't tell you what an honor it is to be in nursing in this time in our life. How many nurses in here? Oh, good. Congratulations to you all. You know, with all the changes coming and the future of nursing, we have a great journey ahead of us, no matter how old we are, correct? So I'll be talking a bit about group care. The group care that I'll be talking about is titled Diabetes Your Way, and you'll understand why we named it Diabetes Your Way, because it's very patient-centered and very patient-controlled. Because you can lead a horse to water, but you cannot make them drink. So concepts that we'll be covering, next slide, will be understanding group approach to patient care and education, and some methodologies we have used for success. Understand contribution of the model that we have been using, how to implement this model into primary care. We use three main tools with ours. We use accelerated learning, motivational interviewing, and a facilitative type style of group interaction. And I'll talk a little bit more about those. And then, of course, a program doesn't mean anything unless you measure outcomes and look at if it's succeeding or not. So, essential elements. I have to tell you the background and the story of how Diabetes Your Way came along. As a nurse manager of primary care, you kind of look at outcomes of your patients that come through your clinic. And I love primary care because primary care, you really become their family. You really are the chain of care in that person's life. And when I started looking at diabetes, we have a lot of elderly population, a lot of chronic disease. I started looking at outcomes of our patients and was a little dismayed at where our A1Cs were with our diabetics. And I thought there has to be a better way to help patients self-manage their care. And so with that, I started out doing research on combining group education with shared medical appointments. And I hadn't seen a lot of that combination taking place. So did a lot of research, wrote a proposal, handed it off to our chief of staff, and got the blessing to move ahead. Well, you never move ahead with a project unless you pick the right team. So there were 3 other nurses in our facility, a nurse practitioner, and of course the diabetic education person. You cannot run a diabetic clinic without somebody's expertise in that area. We spent a lot of nights at a local coffee shop, grassroots effort on our own time, saying how could we model group care with shared medical appointments. And so it took about a year to come up with this model, and then we started implementing it. Some of the essential elements we found you have to have is group care really is very, very effective. You have to have the space for it. Patients have to be involved in their care to be able to enhance self-management. How do you do that? You've got to have a type of an educative class where they're engaged and involved. Facilitative leadership and motivational interviewing and accelerated learning, I'll talk about those a little later on, because it really allows for the patient to draw on their strengths and needs. We have been so provider-driven in giving care. That is no longer going to be the model of care. It's very patient-centered, and it's a very team approach of care. You hear the word medical home, patient-centered, that's where we're all headed. And so we knew that component had to be in there. We decided that we would do planned sessions. We have a notebook with 6 weekly sessions. The patients come every week for 6 weeks. Then after that, they actually have 3-month shared medical appointments all together with one provider. It's very open. They all are very clear that it is consent in a group atmosphere. There's no issues with privacy because we cover that. They know they're going to be in group care. Optimal size we have found is 8 to 10. However, we have ran 11 to 15. Our family members are very encouraged and invited to come because they are also the overseers and the workers with the patient that has diabetes. You don't do the journey of diabetes by yourself. And then family support, of course. So there we started, and we started last January was our first class. We are on our 12th class, and I'll talk a little bit more about that as we go on. We knew we had to have some kind of evaluation and outcomes, and so we actually have about 16 outcomes that we measure. And then we wanted to make it fun, where it would be a time of socialization and participation from the participants of the class. And of course, effective learning methods. Accelerated learning. Who has heard about accelerated learning? Accelerated learning is awesome because you really match the heart to the brain. You do a lot of activities of where you're taught something and then you actively do a project or process to make it connect. Very, very effective in learning. Motivational interviewing, I'll talk about that in a bit. And then we actually wanted to make sure it was a team approach. And we have key people come, topic experts. PT comes to one of our classes and does exercises. Diabetic educator is at all of our classes. Nursing staff is there as facilitators. We have a provider champion who is amazing. And then pharmacy comes and talks. And then on our last week, our 6th week, and I'll talk about all of our weeks, we actually have a panel of all these experts that come back. And it's kind of an open forum of putting the journey together where the patients are actually allowed to ask questions or maybe something they needed a little bit more talking on. So it's a very, very team approach because we don't want our patients to think that it's just you and the doctor anymore. I love the future of nursing. One of the 4 key things of the future of nursing is that nurses become partners with the doctors. It's really a team approach. And have you seen that in your facilities? Are you seeing more of that as nurses? Raise your hands if you are. Yes, because that's where we're headed. And that's exciting because I think to the patient, it doesn't mean that they just have one person to call. They have a whole safety net. This whole team is taking care of them. So we wanted that included. Motivational interviewing. Who's heard of motivational interviewing? Motivational interviewing has been used a lot since the 80s with substance abuse and therapy for patients. But what they're finding is it's becoming very, very effective in changing behavior, health behaviors, and increasing self-management of care. So what is motivational interviewing? Go ahead and change. It's a way to motivate patients to pursue and reach their own personal goals, capitalize on their strengths, and make a challenge to improve weakness. And it's really a way of having them become the captain of their ship. You kind of stand back and let them become the driver and the captain of their sailboat because we can't make it happen, only they can. It's very important to ask the right question. Think of MI, or motivational interviewing, as a toolbox. It's a collaborative, very patient-centered form of guiding and strengthening motivation for change. We'll be talking about 3 tools. I call them, and that's your toolbox. OARS, they're acronyms, OARS, GRACE, and then developing key behaviors, which we use accelerated learning for. So let's talk about what is OARS. Open-ended questions. How often do we go to our primary care appointment and we're asked what we think? I've had the privilege to be going through some pretty intense medical care in the last year, and it's been a real wake-up call being a patient. I can't believe how provider or nurse-led our care has been, and we often forget to ask the patient what their part is. So OARS is open-ended questions. It's not, are you feeling good today? Yes or no. It's like, what have you done in the last week to improve your health? It's that open dialogue where the patient starts talking. And motivational interviewing really is a lot of open-ended questions. Affirmation. When was the last time we heard, good job? Not very often. We're pretty stingy with compliments. When our patients succeed, we've got to remember to affirm them and tell them congratulations. Celebrate the little things. If they have to lose 100 pounds, don't look at the end of the journey. Celebrate the 3 pounds that they lost. Or celebrate the blood sugars that they kept in control for 2 days, because that's the start of the journey. Reflective listening. That doesn't happen very often. Those are things that you say, oh, I heard you say you'd like to make a change, but boy, you just find it's really hard to make choices in foods. It's after the patient states that, you kind of reflect back what they say. And then summarizing. You're having a difficult time getting your diabetes under control, but I hear you're really worried and you want to stay healthy for your grandchildren. So you listen to the patient. It's a lot of listening. One of the main tools we use in our classes is facilitation. It's very patient-driven. And I tell you what, when we started this, we almost had to think of our mouths with duct tape on them. Because when patients said something, we wanted to correct it or fix it. And so it's really an art of learning to just listen and let them facilitate. It is amazing how much our patients know. And it's amazing how you can facilitate kindly. If somebody read something on a website that you know is crazier than heck, you don't correct them in front of the class, but you can say, John, what do you think about what Jim said? Do you agree with that? And then it starts dialogue and you get the right answer. But you're not directing, you're helping them pull the information out of one another. So learning how to re-talk. The next one is really asking the right question. We so many times just ask yes or no questions. That's not going to move our patients along a continuum of care to reach a higher level of health. It's just not going to work. We go through our checklist because we have to get them in 20 minutes and out in 20 minutes. We've got to get their blood pressure, their weight, their height, and all those things. And usually it's just yes, no answers. So it's learning how to re-talk and how to ask the right question. And then grace, creating the gap. I just gave an example of that. I heard you say it's really hard to control your diabetes, but you really want to be healthy for your grandchildren. So it's creating that gap by listening to what they're saying and looking for that gap and taking that opportunity. Rolling with resistance, you're going to get a lot of arguing, but you don't get pulled in the dance of arguing. That just makes a patient defensive, and you're going to lose them. They may say, well, can't eat a darn thing now that I have that diabetes. And you can say, you feel like there's no choices for you to eat. Instead of saying, well, yeah, you can eat about 100 things. What are you talking about? So you don't get caught in that arguing. You roll with the resistance. The can-do attitude. Saying things like, John, what have you succeeded in the last 10 years? List me one thing you've succeeded in. Well, one of our guys wanted to go to a hunting camp and never felt his blood sugars were in good enough control. Well, they really weren't in good enough control when he went. But he made that a goal, and he got there. So what is it, John? How'd you get there? What'd you do to succeed? And really helping them remember they do have a can-do attitude. And then, of course, empathy. Empathy and sympathy are not the same things. It's not, oh, you poor little thing. It's more like, it is hard, isn't it, John? It's that empathy of agreeing with them. These are the parts of motivational interviewing. I wish I could spend 8 hours talking about motivational interviewing. It is so effective. And there is research done on how effective it has been in substance abuse and really starting to get used more in the medical field. And then, of course, developing key behaviors. High-performing goals and results, drawing that out of the patient, not pushing the patient to goals, but pulling the goals out of that patient. John, what do you want to be a goal within the next 2 months? What about your diabetes do you want to change? And let them lead that. Assure that they know the keys to success for positive outcomes. If you're not going to give them the tools, then they're not going to know the keys to success. Push for innovation. Think outside the box. It was great at one of our diabetic classes. We were doing label reading. And one of our little guys came forward and he goes, wow, I am so shocked, because their assignment was to look at labels for the week. And he said, I go hiking and I take these granola snacks. Oh my gosh, look at the carbs in them. And then it was interesting that one of the other guys said, yeah, but Abel, you're out hiking. You do need to increase your carbs while you're hiking. So it turned into this whole dialogue of them teaching each other.